Segment is sponsored by Optum Utah. Do you want to prioritize your heart health but do not know where to begin? Dr. Christopher Valentine is here to tell us what we need to know. Welcome to the show, doctor.
Thank you.
Great to see you. Okay, what are some of the key risk factors for heart disease? We're thinking it's Heart Health Month, so what are the key risk factors?
I'd say, as far as getting the biggest benefit from being aware and making behavioral changes, I'd say there are 5 things. First is, of course, smoking. That's going to be the biggest risk. Also, keeping an eye on your weight. Overall, incidence of obesity is a huge thing. Blood pressure, looking at your glucose levels, talking about diabetes, and your lipid level, that is to say your cholesterol level. So understanding all 5 of those things it will go a long way to addressing your risk.
Sure, good to know those 5 things. Okay, and what are some lifestyle changes or healthy behaviors to adopt to help prevent these issues?
Right. Well, starting with smoking, obviously those I often tell patients that is like the number 1, 2, and 3. Fortunately, we don't have super high rates of smoking in the state, but as far as obesity is concerned, it's not just a matter of weight, it's also a matter of your just overall diet. Adopting a Mediterranean diet, which consists of a lot of fruits and vegetables and legumes and healthy fats and things like that. And exercise. Exercise goes a long way to actually helping to manage your blood pressure. And I think beyond that, having a good relationship with your primary care physician so that you can assess and understand what is my risk for diabetes and what is my cholesterol level. Because a lot of those things are genetically determined and we don't know unless we check.
Yeah, we need to ask. We need to know those numbers. Okay, what are some warning signs of serious heart conditions? What should we be looking for?
Right. Well, for one thing, a lot of times these things are, we refer to high blood pressure as the silent killer. So sometimes there aren't symptoms, which is why prevention is so important. But if you are starting to have problems with chest pains, especially with exertion, or even some unusual symptoms where you're having a dull or ache in kind of your upper abdomen, sometimes it will extend to the shoulder or to the jaw. These would be reasons to seek medical attention immediately because they can be early signs of a heart attack. Thinking about stroke, sometimes people will have problems with double vision, difficulty speaking, numbness or weakness. So if you or a loved one start having any of these kinds of unusual symptoms, it's better to be safe.
Just be safe.
Yes.
Sure. Yeah. And if it's not only yourself, if you're noticing these symptoms in somebody else, make sure to help them out and just call for help.
That's right.
What are some important screenings or tests to make sure that we're doing?
Well, I would say that, like I mentioned, going in and seeing what your sugar levels are, your fasting glucose levels, in order to make sure that you don't have diabetes or pre-diabetes, because that elevated level of glucose in your blood over time, it just like high blood pressure, it causes wear and tear on our cardiovascular system and increases our risk. So understanding that, understanding our blood pressure, like I said, we might feel totally fine and say, oh, I feel fine, I don't have high blood pressure, but we can't go based on symptoms alone. So it's really important to get that really pin down where that's at. And the same thing with cholesterol. And I know that historically we think, well, I have a really healthy diet, but so much of this is genetic and we need to know.
You need to know. Okay, thank you so much for this information. Where can we go for more, doctor?
I would go to optum.com/Utah for more information.
Okay, great to see you. Thanks for all this information. Thank you.
Appreciate it.